Hello, everyone. Hope you're all having a fantastic day. Today's session is one of the most important sessions that we had so far. And it's all about breast cancer basics and what you need to know about the screening. I'm delighted to have Dr. Gordon with me today. Welcome to our community, Dr. Gordon.
Thank you. Thanks for having me.
If you can tell us a little bit more about yourself, please, and your background, and then we'll start the presentation.
So, I'm a breast radiologist, and you probably know that radiologists do all kinds of things like look for broken bones and CT scans and chest x rays and that sort of thing. But I have limited my practice to breast radiology, which is mammography, breast ultrasound, and what's called image guided needle biopsies. And I've done that for decades now. I work in Vancouver, British Columbia. I work mainly at the office of Dr. Warren and Associates, but I also am the former director of the breast program at BC Women's Hospital, and I still work there part-time.
Fantastic. And we have your bio and all the details on the platform already. So, ladies, please make sure that you check that. And we also work with Dense Breast Canada and mybreastscreening.ca. We'll have those links as well. These are great resources for all of you, especially those who are in Canada, to learn more about the resources that you have. And it's all about having the experts and community together when it comes to a topic like this. So we'll add all the links. We'll have your bio on the platform. Let's start the presentation now.
Okay, Mona. Can you see my screen?
Yes, it's perfect.
Okay, great. So again, thanks so much for inviting me to speak. Good afternoon or good evening, everyone, wherever you are. I'm going to give you a crash course on breast cancer, the options for prevention and screening. And I want to introduce you to the important aspect, as you heard from Mona, of dense breasts. But first, I'll start with the basics. Here are my disclosures. I'm here on a volunteer basis, and I'm not paid by industry or anyone else to give lectures about breast cancer. Today, I'll explain what breast cancer is and what the signs of cancer are that you can look for. I'll stress the benefits of early detection, and I'll tell you how to increase the likelihood of finding cancer earlier. I'll explain what dense breasts are and why it's critical for you to know if your breasts are dense. And as we go through, I'll point out some common myths about breast cancer. So let's start at the beginning. What is breast cancer? It's a disease where a group of cells loses the normal control. And these abnormal cells grow, usually into a lump, but not always, and they invade and damage the adjacent normal tissue. They can spread to other parts of the body, like lymph nodes, as well as other organs like lung or bone or brain or liver. And breast cancer is not life-threatening when it's confined to the breast. It's when it spreads to other parts of the body that it can kill. Many cancers can be found before this spread happens and when they can be more easily treated. So, who gets breast cancer? Well, anyone at any age. Breast cancer is very uncommon, but still occurs even in the 20s and 30s. Myth number one, some women tell me that they don't have to worry about getting breast cancer or have screening because there's no one in their family with breast cancer. That's not true. 75% of women who get breast cancer have no family history. Even men can get breast cancer. About 1% of breast cancers occur in men. Now, you may have heard that statistic, the 1 in 8 women get breast cancer, but that's not across all ages. This chart shows the risk of developing cancer in the next 10 years at a given age. So, as I said, it's very uncommon in young women, but the incidence jumps dramatically in the 40s. At age 30, only about 1 in 228 women get breast cancer, but at age 40, it's 1 in 69. So, myth number two, women sometimes tell me that they don't need a mammogram now that they're 60 or 70. But unless a woman dies of another disease, her risk of breast cancer keeps climbing. And myth number three, I sadly hear from younger women in their 20s and 30s that they didn't see their doctor when they found a lump in their breast because they assumed that they were too young to get breast cancer. That's not true. In fact, some doctors tell women, "Oh, you're too young to get breast cancer," and that's not true. So we know that annual mammograms starting at age 40 save the most lives. And this is recognized even by organizations that recommend starting later or screening less often. I'll talk a lot more about that. These are the current guidelines from some of the organizations in Canada and the US. And you can see that the recommendations for what age to start and how often to screen vary widely. These conflicting guidelines did not arise because of different facts. They arose because of different value judgments applied to the same facts. And I'll talk a little bit more about that. You have to understand what your value judgments are and how they align with the organization that's deciding for your screening. So many of you may live in places where screening mammography isn't offered to women until age 50. And you may know younger women who were diagnosed with breast cancer in more advanced stages as a result. Here's why it's important to start at 40. Research has shown that the most lives are saved when women have their mammograms every year starting at 40. 1 in 6 breast cancers are diagnosed in women in their 40s, and 41% of the years of life lost to breast cancer are in women diagnosed before age 50. If you live in Canada and you don't know when you can start having mammograms, please look at this new website that Mona mentioned, mybreastscreening.ca. Another good resource for facts about screening is the End the Confusion website. You can just Google End the Confusion screening mammography if you don't have access to the slide. So breast cancer is less common in younger premenopausal women, but it's more aggressive in those age groups because of the presence of ovarian hormones. Hormones don't cause cancer, but when cancer develops, the hormones can act as fuel on the fire. So it's not trivial in younger women. As I told you, 1 in 6 breast cancers occur in women 40 to 49, which equates to more than 3,300 women each year in Canada. So if we want to find cancers early and save lives and give women the option of less aggressive therapies, we should screen all average risk women starting at 40. And starting at 40 is especially important for Black, Asian, and Hispanic women. They develop breast cancer younger than white women. I didn't know whites. And the peak incidence is actually in the late 40s, which is a decade younger than the peak in white women, which is in the late 50s. We're all at risk of developing breast cancer, but there are factors that can increase a woman's risk of getting breast cancer above average. Now, many of them are beyond our control, like the ones listed on the left, like having one of the breast cancer genes, having had radiation for Hodgkin's lymphoma, having dense breast tissue, a family history of breast cancer, especially in a first-degree relative like a mother or sister, having a previous biopsy that showed atypical cells, if you started your periods early or went through menopause later, or even if you just had no children, all of those increase the risk of getting breast cancer. Now, the list on the right is a list of factors you can control to reduce your risk. So minimal or no estrogen after menopause, minimal or no alcohol, a low-fat diet, moderate exercise, not smoking, and maintaining a healthy body weight. All of these can reduce your risk of getting breast cancer. We want to find breast cancer as early as possible, but wouldn't it be better if we could prevent it from happening in the first place? If women modified their habits around the controllable risk factors from the previous slide, even if they waited till middle age to make changes, it's thought that as many as half of all breast cancers could be prevented. And if we started in childhood, it's thought that most breast cancers could be prevented. For example, walking 30 minutes a day reduces risk, and breastfeeding for a year, and that's not each child, but a year altogether, reduces breast cancer risk by 20%. An overweight woman who loses 10 pounds decreases her risk by 10%. And if she loses 20 pounds, she reduces risk by 50%. The other thing people don't like to hear sometimes, each drink of alcohol per day, and that includes beer, wine, or spirits, raises breast cancer risk by 10%. But we are all at risk, even if we follow all the rules. The strongest risk factor for getting breast cancer is being female, and the second strongest is getting older. And remember, 75% of breast cancers occur in women who have no family history. Doesn't want to go. There we go. So what are the signs of breast cancer? Well, it can show up in many ways. As a lump, Sometimes it's a thickening, not really a lump per se, but an area that feels firmer than the tissue around it. Sometimes it's dimpling on the skin or a crust on the nipple, warmth or redness, sores on the skin, or discharge from the nipple. Now, I just want to reassure you, discharge can be normal, especially if it's white, yellow, or green. But if it's completely clear like water or bloody, and if it comes out without squeezing, then it has to be checked. Sometimes it's found when a woman notices a change in the size or shape of her breast. For example, a breast can suddenly shrink, or sometimes if a breast swells. Now, rarely, if a vein under the skin gets bigger, it can be a sign of cancer. Nipple retraction, that's when the nipples are pulled in, can be normal. But if it's something new, it should be checked. And if the skin gets thick and dimpled like the skin of an orange, that should be promptly checked. And although cancer can show up as a lump, it's important to know most lumps are not cancer. This photo is from a foundation called Know Your Lemons. It shows some of the ways breast cancer can manifest. They have a website and an app you should have a look at. It's knowyourlemons.com. It's easier for some people to look at a lemon and look for the signs rather than look at a picture of a woman's breast. But I'm going to show you a woman's breast. So most lumps are not cancer, but any new lump should be checked. The picture on the left shows a lump bulging. You can see it bulging the skin forward. Here's a cancer that's causing indentation of the skin or dimpling. And this happens when a cancer is close to the skin and sometimes it pulls the skin in. That sign is highly suspicious. So pay attention to what your breasts look like when you're undressed. Everything I've shown you so far is about how to detect cancer when it's visible or feelable. But we do screening to find cancer earlier before it can be felt as a lump or seen as dimpling, etc. By screening, we can find and treat cancer earlier and save more lives. And when cancer is found early, it can be successfully treated with less aggressive treatment that would be needed for more advanced cancer. Many different tests can be used to screen for cancer, but please know thermography has been thoroughly discredited. It should not be used for screening. Today, I'm going to focus on breast self-exams, mammography, and ultrasound. Now, many women find their own cancers by doing breast self-examination. This is not how to do it. The term breast self-exam has fallen out of favor. The term you'll hear now is that women should be breast aware. In plain English, that means pay attention to how your breasts look and feel. You don't have to do breast self-exam diligently every month, but if you don't know what your normal breast tissue feels like, you won't know that there's been a change. So you do have to do it periodically. There are lots of demonstrations of how to do breast self-exam on YouTube, but an excellent one that I recommend is by Dr. Liz O'Riordan. She's a breast surgeon in the UK who has had breast cancer. Please check it out. It's only 3 minutes long. And Mona, I hope you're going to pass on this link as well. I'm going to show you a lot of numbers today, but there's one number I want you to remember. Annual mammograms starting at 40 save the most lives. And there are loads of research papers, but here are two important ones. This study from Canada compared women who had mammograms to those who didn't. They got data on almost 3 million women attending screening programs in Canada. This is the largest study of its type ever published. And they showed that women who have screening are overall 40% less likely to die of breast cancer than those who don't. And for women in their 40s, they're 44% less likely to die. But strangely, in Canada, most provinces still only screen every other year starting at 50. This group in Sweden showed that women who had screening were 60% less likely to die from breast cancer in the first 10 years after diagnosis, and 47% less likely to die from breast cancer within 20 years of diagnosis. So before I talk more about the evidence in favor of screening, let me take a step back to show you more about mammograms for those of you who haven't had one yet. This is how a mammogram is done. Each breast is compressed twice, once from side to side, like the picture on the left, and once from top to bottom. And a low dose X-ray is taken in each position. These are pictures online that are supposed to prepare you for what a mammogram looks like, but they're absolutely, don't believe them, they're silly. The one on the left shows the technologist and patient having a lovely time chatting and smiling at each other. The one on the right shows the patient standing with her breast compressed in the machine, arms outstretched, while the technologist takes her time looking at the image. This never happens. For the vertical compression picture, like on the left, the technologist has one arm around the patient's shoulders and she's gently holding her body as far into the machine as possible. Her other hand is pulling the breast forward while she gradually and gently lowers the compression plate using a foot switch. And the reason she's pushing the patient as far as she can into the machine is she wants to include all the breast tissue, even at the back. We don't want to miss a cancer because it wasn't on the film. Now, for the angled picture you can see on the right, she's holding the breast forward and smoothing the skin so there are no wrinkles on the picture that can affect the quality of the mammogram. And here's what the pictures look like. The two on the left are the top to bottom squish pictures, and the two on the right are the side to side squish pictures. And you can see this white blob here. This is the right breast. This is top to bottom, side to side, and that's a cancer. Here you can see the arrow pointing at the cancer in the right breast. And the reason we can see this cancer so easily in this breast is that the cancer is white and the rest of her breast is dark gray. More on this later. Now let's spend a couple of minutes talking about radiation. I know it's a concern for some of you, but not for experts. You'll see why. There's radiation all around us all the time. Natural background radiation comes from the cosmos. The sun and stars send radiation to Earth, and the amount varies with the elevation. So people who live high up in the mountains get more radiation than people who live at sea level. There's radiation from the ground. Radioactive materials exist naturally in soil and rock. There's radiation in the air because all air contains radon, which is the greatest source of background radiation, and even water contains small amounts of dissolved radioactivity, and all organic matter, both plant and animal, contains radioactivity. Radiation risk from breast cancer from a mammogram is primarily in women younger than age 20, and we just don't do mammography in women young as that. The amount of radiation in a mammogram is roughly equal to the amount you'd receive taking 5 one-way transatlantic flights. And as I said, the higher you are in altitude, the higher the dose of radiation. And that's because of less shielding of cosmic radiation by the atmosphere at higher altitudes. So flight attendants know that they have significant occupational exposure to ionizing radiation. Another way of looking at it, the dose from a mammogram is similar to the natural radiation you'd get if you lived in Colorado for 7 weeks. 7 weeks at sea level, or 3 to 4 weeks living in Colorado. So higher dose with higher elevation. This graph is from an excellent website, densebreastinfo.org, and it shows the radiation from various tests. You can see that the lowest radiation is from bone densitometry and chest x-rays, and mammography is the third lowest. Look at the other kinds of tests. I'm sure some of you have had some of these CT scans and so on with much higher doses of radiation. The blue vertical line on the right, with the arrow pointing at it, that's the amount of radiation that's felt to be safe for me as a radiation worker to get every year. And it's over 12 times the dose of a mammogram. So the other thing you need to know when you're deciding if you're going to have a mammogram is, well, what are the downsides? And like any other screening test, pap test, for example, mammograms have false alarms. That's when a woman has a screening mammogram and gets called back for more tests, but turns out not to have cancer. And in some places, they're using these false alarms as an excuse to not offer optimal screening, annually starting at 40. So here are the real numbers on false alarms. For every 1,000 women screened, 93% will get a normal result, and about 7% or 70 of those women, 70 of the 1,000 will need additional tests. The majority of them will only need one or more additional mammographic pictures. Some will need ultrasound, and 11 of the 70 who were called back will need a needle biopsy. And these are done with local freezing, and they should not be significantly more painful than having a blood test from the arm. Of those 11, 4 of them will be diagnosed with breast cancer. Now, being recalled for additional tests can be scary, but remember, when you get a recall, it doesn't mean you have cancer. In fact, 95% of the recalled women don't have cancer, and they'll be understandably anxious until the tests are done, and we can be sure there's no cancer. But it's not a reason to not have screening. It's a trade-off. The cost of finding cancer early to save lives means that some women will have that transient anxiety. That's the risk every woman takes when she decides to have a screening test, be it a pap test or a mammogram. But remember, the cost of not screening is the loss of opportunity to find cancer as early as possible, and the consequences of that, which are certainly not transient. So this sums up the position of panels who recommend against screening because of anxiety. And in case you can't read the caption, it says, yes, regular mammograms and early detection would have saved your life, but aren't you glad we spared you all that anxiety? It's somewhat patronizing and condescending for a panel to make up a decision when it really should be up to the woman herself once she knows the pros and cons. Now, annual screening would save the most lives, but none of the provinces in Canada offers annual mammograms to all women. We have a mishmash of screening across the country, and in some provinces, women can start at 40. All provinces and territories do allow women with a mother or sister with breast cancer to attend annually, but only 4 allow all women 40 to 49 to come annually. And remember, I told you we want younger women to come more often because they still have ovarian hormones. In 6 provinces, women are recalled annually if they have dense breast tissue, which we'll discuss shortly. So remember, if you live in Canada, check out mybreastscreening.ca to find out what's offered where you live. And if your province doesn't start till 50, you may be able to persuade your family doctor to send you for a diagnostic mammogram. They include the same pictures as a screening mammogram, but have the option of the additional pictures if necessary. Outside of Canada, check the websites in your country and see what your insurance covers. But if your health care is private, remember, annual mammograms starting at 40 save the most lives. So it makes sense to screen all women in the 40s, but that isn't the case everywhere. These women, and I'm sure there are some among my audience today, have the most potential years of life to lose if they have a cancer that's undiscovered until it's advanced. Women in the 40s are often caring for young children and aging parents. They're working and contributing to the economy. These women are not expendable. So, and when should screening stop? Well, most jurisdictions stop at 74, so none of these familiar faces would be eligible. And that's because the old studies of mammograms done 30 to 50 years ago included women only up to age 74. So many programs claim that there's no evidence that screening women older than 74 saves lives, and that's just nonsense. Breast cancer risk increases with age, and as I said, if you don't die of something else, your risk of breast cancer keeps climbing as you get older. So now many organizations recommend, and I agree, that if a woman is in good health with a life expectancy of 10 years and she's well enough to have treatment if cancer is found, then it's worth continuing screening to find those cancers when they are small. Because if you let them grow large enough to feel and be found as a lump, more extensive surgery may be required. And for some women, by the time that happens, her health may not be as good and she may be less able to have treatment. So an individual woman's decision to continue screening should be based on her health, her life expectancy, and her values. This is from Statistics Canada. The average life expectancy for a 75-year-old woman is 13 years. And at age 80, it's 10 years. So stopping at 80 would be reasonable, but it depends on your general health and your personal values. I have a friend who's 84 years old and extremely active. She bought a bicycle last year and she rides 10K 3 times a week, and she's still having mammograms. The people who recommend starting at 50 and stopping at 74 are basing this on data from that old research I told you about, 30 to 50 years old, and they ignored the more recent studies that I showed you. Those trials reduced deaths from breast cancer, but there were 3 other significant benefits of early detection that those organizations didn't consider. The option to avoid mastectomy and have breast conserving surgery. The option to avoid the big armpit surgery that can cause swelling of the hand and arm, and the option to avoid chemotherapy. Okay, here comes some people pictures. So finding cancer early can mean the difference between needing a mastectomy, like the picture on the left, or having a lumpectomy. This woman has had treatment for cancer. Doesn't she look great? This is what lymphedema looks like. It's swelling in the arm and hand from blockage of the lymphatic vessels in the armpit, and it's a side effect of the traditional armpit surgery done as part of breast cancer lymph node staging. It's usually permanent, and arguably, it's the worst part of breast cancer for many women. But when cancer is detected early, women can have a much less invasive procedure called a sentinel node biopsy, which has a much lower risk of lymphedema. Chemotherapy, of course, is awful, but it's temporary. But now, with genomic testing, many women can avoid chemo if their cancer is small and there are no positive nodes, and they're determined to be at a low risk of recurrence. This is another reason to find cancers early that weren't considered by those people who say we should only screen from 50 to 74. So, what is the issue with breast density? If we all agree that it's important to find cancer, then we have to talk about this. We're pretty good at recognizing cancer on a mammogram when it's visible, just like that case that I showed you of the white cancer in the dark gray breast. This is another cancer, and this is obviously a cancer. She's 55 years old, and the reason it's obvious is because of these jaggedy edges, and you might be able to see these fine white dots. Those are suspicious calcifications. Now, just remember what this cancer looks like for the next few slides. It's relatively easy to see cancer when the breast is mainly fatty, like in this woman. On a mammogram, fat is dark gray. So if you've been told that your breast density is category A, this is what your mammogram looks like. And if a woman had fatty breasts and she had cancer, we'd have no trouble seeing it in her breasts. That's the cancer from the few slides ago. These breasts are also normal, but they're not all dark gray. There's a little more white tissue, and that's normal breast tissue. White is the opposite of fat, and we call it dense because it blocks the passage of x-rays through the breast. So this is what category B density looks like, and we'd have a good chance of seeing that cancer in these kind of breasts. These breasts are normal too, but they have even more dense tissue, lots of white, and it becomes harder to see those white cancers, like we say, trying to see a snowball in a snowstorm. And this is category C. It would be challenging or impossible to see cancer in these breasts. It's actually hiding here between the yellow arrows. And some women have virtually no fat and they're all dense, and this is category D, like these. Even a large cancer could be missed in this mammogram. And in fact, we miss as 50% or so cancers in women with category D breasts. Mammograms find about 98% of cancers in women with fatty breasts, but less than 50% in women with the densest breasts, even with modern digital mammography. Let that sink in. We miss over 50% in category D. So for women with dense breasts, it's potentially harmful for them not to know their breast density, because if they're told that their mammogram is negative, it can give a false sense of security. And you probably all know of women who ignored a lump because they'd recently had a negative mammogram. So a negative mammography is not always no cancer. This animation, I hope it starts, shows why we say that looking for cancer in a dense breast is like looking for a snowball in a snowstorm. I might have to click here. A cancer that's easily seen in a fatty breast can hide easily in dense tissue. Radiologists divide breast density into 4 categories, which I've alluded to, categories A to D. Categories A and B are considered non-dense, and categories C and D are considered dense. And breast density is generally higher in younger women and can diminish with age, but there are certainly young women with fatty breasts and elderly women with dense breasts. Here's a real life example of dense tissue hiding a cancer. This woman had a negative screening mammogram at age 50, and you can see she's category C or D. But remember, negative doesn't always mean no cancer. 8 months later, she came back after finding a lump in her left breast, and you can see the triangular skin marker where the arrow is pointing. That's a sticker that the technologist taped on the skin over the lump, so we knew where it should be showing on the mammogram. And we repeated the mammogram, and there was still no abnormality, even though we did what's called a 3D mammogram or tomosynthesis. But when we did her ultrasound, we saw a 3.2 centimeter cancer, and it had already spread to her lymph nodes. When a cancer is diagnosed after the most recent screening mammogram was negative, it's called an interval cancer. And interval cancers are 18 times more common in women with dense breasts. This woman helped advocate for the changes that occurred in screening policy in British Columbia. Thanks to her and other patient advocates, all women in BC are now notified of their breast density, and screening ultrasound is even covered by public health insurance. We need more women to speak up to get better screening everywhere. Interval cancers are larger and they're more often spread to the lymph nodes than cancers that are detected at screening. They tend to be more aggressive, so they have a poorer prognosis. We can do better at finding cancer early in more women. The biggest risk of dense breasts is the masking of cancers that I showed you. But here's the double whammy. We have known since the 1970s that breast density is an independent risk factor for developing cancer. So women with the densest breasts are 4 to 6 times more likely to get breast cancer than women with fatty breasts. Having dense breasts is actually the most prevalent risk factor, more so than having a significant family history. So women with dense breasts are at a higher risk to get breast cancer and at a higher risk that will miss it on their mammogram. So hopefully you'll never get breast cancer. And if you do want it to be found on a mammogram or other tests, preferably not as an interval cancer. But here are the risk factors that increase the possibility of an interval cancer. Obviously, dense breasts, a family history, a prior biopsy that showed atypical cells, or being overweight. And if you fall into one of these categories, try to have a mammogram every year. And if you were obese or overweight, there's so many other associated health risks. It's definitely preferable for you to get to a healthy body weight. And I'll tell you now about dense breasts and what you can do to decrease that risk. Here's the thing, dense breasts are normal and common. Every woman has fat and normal breast tissue in her breast, but the proportions vary from woman to woman, like I showed you, from A to D. More than 40% of women over the age of 40 have dense breasts. And while it's normal to have dense breasts, women need to know if they have dense breasts so they can understand the implications. In Canada, there are 3.4 million women over age 40 with category C and D. There are over 800,000 women that are category D in Canada. So how can you know if you have dense breasts? Well, you cannot tell by breast size or how your breasts feel, and your doctor can't tell by a physical exam. Breast density can only be determined on a mammogram. Now, usually the radiologist looks at the mammogram and chooses what category, but more and more, some systems are using software to measure the density, which will hopefully be more objective and reproducible. Now, lumpy breasts are not the same as dense breasts. You can have lumpy breasts that are totally fatty. Both fatty and dense breasts can feel soft, firm, or lumpy. And where does ultrasound fit in? Well, for many years, it was believed that ultrasound could not find cancers that were not visible on mammography and were too small to feel. We've known for over 25 years that ultrasound can find cancers that are too small to be feelable and missed on mammograms, largely because of dense breast tissue. This trial found an average of 4.3 cancers per 1,000 women over 3 years, and 94% of those cancers were small, invasive, and hadn't yet spread to the lymph nodes. That's when we want to find cancers, when they can be treated less aggressively. Ultrasound can be done with a handheld probe, like on the left, or with a wide footprint probe, like you can see on the right, that automatically scans about a third of the breast. And it's called automated breast ultrasound, goes by various eponyms like ABUS, automated breast ultrasound. But the handheld is widely available and the ABUS is less widely available. But remember, any ordinary ultrasound machine can do breast ultrasound with a handheld probe, but not all clinics offer it. Now, in spite of all the emerging evidence on breast density, it was still not being shared with women, and in many cases, it wasn't being shared with their doctors. Nancy Capello was a PhD in educational leadership. In 2004, only weeks after her routine annual screening mammogram was negative, she found a lump in her breast, and after ultrasound showed a cancer, she was diagnosed with stage 3C cancer with 13 positive lymph nodes. When she found out that her cancer had been missed on her mammogram because she had dense breasts and she'd never been told about her density, she did her research and found that it could have been detected much sooner with ultrasound. She started a grassroots movement to get women notified when they have dense breasts, and there are now 38 states and the District of Columbia in the US with some degree of breast density notification. 12 states also mandate that screening with ultrasound be covered by insurance. And the FDA has mandated that all women in the US will soon be informed of the risks of dense breast tissue, told their breast density category on their mammogram reports. Connecticut was the first state to legislate, and they now have several years of data. They're finding an additional 3 to 4 cancers per 1,000 women year after year. And these are cancers that were missed on their mammograms. Thanks to the efforts of Dense Breast Canada, a nonprofit education and advocacy group, British Columbia was the first province in 2018 to inform all women of their breast density when they have a screening mammogram, and 5 other jurisdictions do so now too. Several only tell women in category D that they're dense, and BC is currently the only province where health insurance officially covers screening ultrasound. My colleagues in Vancouver published our results from the first year we did high volume ultrasound screening. Our cancer detection rate was 7 per 1,000. Remember, the other studies I've shown you were 3 to 4 per 1,000. This is remarkable. We found 7 per 1,000, and the average size was only 9 millimeters. We're finding small, invasive, node negative cancers. Advocates are also active in Europe, and already both France and Austria offer screening ultrasound to all women with category C and D density. Now, here's the thing, your doctor may be unaware. You may already know more about this than your doctor. They may not know that dense breasts are a greater risk of getting breast cancer, and that women with the densest breasts are 4 to 6 times more at risk than those with fatty breasts. Your doctor may not know that having dense breasts is a more prevalent risk factor than family history, or that 50% of cancers are missed in women with the highest density, or that ultrasound can find many of the cancers missed on a mammogram in dense breasts. So here's what you have to do if you have dense breasts. Well, first of all, you have to find out if you do. You have to continue having mammograms because they detect cancers not visible on ultrasound. So ultrasound is in addition to, not instead of mammograms. You should perform regular breast self-exams. Now, ideally every month after your period if you're menstruating. And if you notice any change, see your doctor, even if you just had a negative mammogram. But remember, you don't have to be obsessive about it. It doesn't have to be every single month. Also consider modifying your lifestyle factors to decrease your risk, like getting to and staying at a healthy weight, doing moderate exercise, decreasing alcohol intake, and trying to minimize hormone use. You should speak with your doctor about your level of density, the associated risks, any additional risk factors you may have, like family history and so on, and what the best screening options for you are. Now, to improve early cancer detection in dense breasts, ask for additional screening, such as ultrasound, or if you're at very high risk, MRI. And please help work towards better screening for all women. Consider reaching out to your elected representatives. That's how we got as far as we've gotten so far. Your MP, your MPP, MLA, and advocate for better screening for all women. But here's what I want you to remember from all that information. All women should have mammograms, ideally annually, starting at 40, or as early as you can, closer to 40 if you can, and as close to annual as you can. Remember, some cancers are not detectable on mammograms, so it's worth doing breast self-exam. Get to know what your normal texture feels like, so you'll recognize if there's a change. Most abnormalities on mammograms are not cancer, so don't panic if you get recalled from a screening mammogram. And remember that women who have mammograms are 40% less likely to die of breast cancer. Ultrasound can find cancer missed on mammograms and dense breasts. And remember, the 2 risks of having dense breasts are, number 1, it increases the risk of getting cancer, and it reduces the accuracy of mammography. So it's important to know your breast density and understand the implications. For instructions on how to do breast self-exam, see Dr. O'Riordan's video on YouTube. For more information on breast density, look for Dense Breast Canada online, Facebook, Twitter, and Instagram. If you live in Canada and don't know when you can start having mammograms, check out mybreastscreening.ca. And if your doctor wants more information, an excellent website, which is US-based, is densebreast-info.org, because it has a section for patients and one for doctors. So that was a lot of information, but it's just the tip of the iceberg. And I look forward to your questions. Thanks for your attention.
Dr. Paula, Dr. Gordon, thank you so much. This was such an educational, informative session. And we do have one comment. Mariam says, "Hi, doctor. Thank you for all this. It is very helpful. I have dense fatty cells in my breast and family history. My doctor has me do 2 mammograms a year. I really appreciate this. No one has ever explained all of this to me. Now I understand the implications. I appreciate you. And thanks, Mona, for having Dr. Gordon here."
I'm a little surprised at the 2 mammograms a year. That's a bit much. I don't know where this person lives. Now, sometimes if we see something on a mammogram and we do the extra tests and we're more than 98% sure that it's not cancer, we might say, come back in 6 months so we can look again. And that way we can be more sure that it's okay. And then 6 months later, she'd be due for her annual mammogram. But we don't do twice a year on a long-term basis.
So Mariam lives between Dubai and Canada, so I'm not sure where her doctor is. So if you're still alive, Mariam, you can answer that. But something that is surprising for me, Dr. Gordon, is that you mentioned dense breasts, they have higher chances of getting breast cancer than family history. And still, the family history you can do, at least in BC, you can do a mammogram once a year, but then with dense breast every 2 years.
That's right. But there are 6 provinces, I think it is, that allow women with dense breasts to come every year. So Canada is a complete mishmash. In fact, one of my colleagues in Ottawa just published a study where they compared the provinces that do annual mammograms for dense breasts and the provinces that don't. And they found that there was a significantly lower interval cancer rate in the provinces that did annual mammograms. So that's just an issue. Each province does their own thing. There are not uniform recommendations from the screening programs in Canada. And yes, if I had my druthers, I would ask that women with dense breasts be allowed to have, well, all women, but women with dense breasts have annual mammograms, but they should also have additional supplemental ultrasound screening because you find more cancers still that are missed on those mammograms.
Absolutely. I didn't know about any of this until my friend had breast cancer this year and she has dense breasts. I didn't even know about it. And surprisingly, when I asked my doctor, I did my first mammogram this year. So they told me I had to ask, what is the density of my breast? They said C. When I went to visit my doctor, I told her, is C dense? She had to Google it. So she said, let me Google it. So even my family doctor was not aware probably of all the information that you shared today. So I do believe that there's a lot of work that needs to be done to raise awareness.
Absolutely. And I do outreach to the family doctors, but this is going to get a little political now. So I referred obliquely to this panel that recommends that women only have mammograms from 50 to 74. Now, there are lots of countries, Europe and so on, that do the same. But this goes back to those old studies I told you about from 30 to 50 years ago. And don't forget, mammography was quite primitive at that time. It certainly wasn't digital and as high tech as it is now.
Mm.
But in Canada, there's a panel called the Canadian Task Force on Preventive Healthcare, and they're the ones that make the screening guidelines. It will horrify you, and it certainly horrifies family doctors when I explain to them that there are no breast cancer experts on that panel. They're mostly family doctors. There's a chiropractor, there's an occupational therapist, there's some nurses, and they're looking at these old studies, ignoring the new studies, and coming up with these recommendations, which just don't make sense if you understand what I told you. And when I reach out to family practice groups, some of them are very happy to hear from me, and I get these wonderful reactions at the end. But some of them don't want me to speak because it's their colleagues, it's the family doctors who are on that task force, and they don't want to contradict their own colleagues. And who's paying the price? Women.
For
So
sure. So yeah, now that we had this session, I will make sure that I will have yearly mammograms. But even when I asked my doctor, do you think I need annually or every 2 years, she said you will be fine with every 2 years. So I do believe that definitely sessions like this are saving lives.
Do me a favor, when you talk to your family doctor about it, tell her that you heard a lecture from me, and I'm happy to talk to any group of family doctors. Even within a hospital, they sometimes have what they call rounds, which is
Mm.
basically a lecture. And just like I reached out and the women at Dense Breast Canada found you for me, I always try to reach the family doctors, because it's really hard for women to advocate for themselves when the family doctors are getting this misinformation from the task force, which are described as being experts.
For sure. And Mariam says that she has lumps and she lives in Vancouver. So her doctor is in Vancouver, the one that was recommended to do 2 mammograms per year. So she replied as well. So we do have a couple of questions. I know you have another session after this, so I'll keep it short. Two of them are about cosmetic breast surgery. So does implants increase the risk of getting breast cancer? Is any
Ab-
kind of implants or any kind of cosmetic surgery, is it something you would recommend, or do you prefer that women avoid that?
So, first of all, implants and other forms of augmentation do not cause breast cancer.
Mhm.
The challenge with implants is that we can't include as much tissue at the very back of the breast.
Mhm.
We have to take two sets of pictures, one that includes the implant, and then the technologist can feel the implant and push it back out of the way and get compression of just the breast tissue. But still, we can't get as far back. I would make a point that some women go to Asia and have injections into the breast. So there's not a discrete little,
Mhm.
an implant is basically a balloon filled with either saline or silicone. But in some places, and it's never been legal in North America, they take a syringe full of something. It can be silicone, it can be wax, it can be various substances, and they just inject it directly into the breast. And those are a disaster
Mhm.
because they completely hide everything on the mammogram. With the body makes scar tissue around each droplet, which then gets calcium, and it's a nightmare to read those mammograms. So definitely don't get your breasts enlarged that way.
Absolutely. And how about the laser hair removal? Is that something on the breast? Is it something that
No,
could cause it? No, that's fine. So
not at
those are
all.
two of the
Not at all.
questions.
Go for it. Go for it.
That's not a problem. Okay. The other questions are, what are the other reasons that we might feel lumps?
First of all, normal breast tissue can feel lumpy.
Mhm.
And most women do have some texture in their breast. That's why we want them to do breast self-exam regularly so they'll know what their own normal texture feels like. And for women who are premenopausal, it's normal for the breast to feel lumpy and more tender before a period. That's why we always want them to do breast self-exam after the period. So they're comparing apples with apples each time. If you mostly examine yourself after your period, and then one time you check your breast and you find a lump and you're expecting your period in the next week, it could be just normal premenstrual swelling. So don't panic. Wait until after your period, check it again, and if it's gone, you can forget about it. But there are other things that are real lumps that aren't cancer. The most common as women get older are cysts. They're little lumps made out of water, and we can see them on mammography, unless the breasts are super dense. We see them easily on ultrasound. And when we're absolutely sure that they're just a cyst, you don't have to do anything about them. Sometimes cysts get really big and sore. And if that happens, it's so easy to give a little freezing medicine, put in a very skinny needle, and suck out all the water, and the patient feels better. But women who get cysts tend to get more cysts as they get older. And the other kind of lump that's very common is called a fibroadenoma. And
Mhm.
it's a lump made out of tissue. And usually we can distinguish between a fibroadenoma and a cancer. Fibroadenomas are very smooth around the edges. They're not jaggedy like I showed you that cancer on the mammogram. And similarly on the ultrasound, they look smooth, and we use the word circumscribed. But there are cases where we're not 100% sure, and that's when we sometimes do a needle biopsy to take some tissue from the lump with freezing, and then we can confirm whether it's a cancer or a fibroadenoma. I will tell you, because women think this must be horrible to have a needle biopsy. Every time I do one, I ask the patient after, was that as bad as you were expecting? And they also, oh no, I can't believe I lost sleep over that. That was nothing. But the
Mhm.
best answer I ever heard after doing a needle biopsy, the patient said, Dr. Gordon, I have shoes that are more uncomfortable than that test. So don't shy away. If the radiologist recommends a needle biopsy, don't be afraid to have the test.
Yes.
Remember those stats I showed you, 4 out of the 11 women, out of the 1,000 women with a mammogram, and we get down to 11 that we recommend a needle biopsy, 4 of them have cancer. So definitely have the needle biopsy, because if it is a cancer, we've caught it early. I mean, if, nobody likes to hear the C word, but isn't it great, good news that we found it early when a woman doesn't need harsh treatment?
Absolutely. And when I shared with you, we had a session together that I have dense breast, and I found that, and I'm worried. When I said I'm worried, I really loved your answer. When you said, like, we don't want women to worry, we just want them to be informed, we want them to take the right steps. And that is the most important thing. Regardless of what it is that is recommended, there is always solution.
And remember, 40% of women have dense breasts. It's normal. And the worst thing about worry is that that's the excuse that these panels use to not recommend what's really best for women. So the Canadian Task Force recommendations, I'll tell you what they are. They say don't do mammograms till age 50. They say even after 50, only do them every 2 to 3 years. They say women shouldn't do breast self exam. They
Mm.
say doctors shouldn't do breast exams as part of a physical. And they say dense breasts don't need any special care. So after everything I've explained to you, I know it was a lot of information to take in quickly. We have a big problem with this task force.
Absolutely. We do have one more question about dense breast, but it's what you do when you have dense breast, but you explained that perfectly. So thank you so much for that. I do have one last question here that says, I do have, I hope I'm pronouncing this correctly, but lymphedema, but in my legs. Do you have any doctor you recommend to see in Vancouver? My legs hurt and they're getting worse.
I think that I think it's not necessarily lymphedema. Sometimes you can have leg swelling and ankle swelling that's just fluid from heart failure. There are other causes of swelling. So really, the family doctor is the one you have to go to, because they need to make the referral anyway.
Hmm.
And they have to do a complete checkup to look at all the possible causes before they even send you to a specialist.
Dr. Gordon, thank you so much. As I mentioned, this is one of the must watch trainings for all of our members. And I really appreciate you for everything that you do. Any final words that you want to share with our members?
No, tell your friends, look at the websites that I gave you. There's a lot of information there that I couldn't squeeze into 45 minutes, but I'm so delighted to have been invited to speak to your group. Thank you so much.
Thank you so much. And we'll see all of you soon. Thank you, Dr. Gordon. Bye for now.
Okay.